Sometimes the stories that patients come back and tell me are unbelievable from when they've gone to their primary care physicians or they've gone to a specialist. So I want to share with you today the story that I found to be both unbelievable, infuriating, and quite honestly, just absolutely wrong. So let's set the stage. Back in June, a high school basketball player was in basketball camp and sprained his ankle. His mom brought him right down to my clinic, and his ankle was huge, and I suspected a fracture. I don't have an x-ray unit in the clinic. I sent him on to a local orthopedic walk-in clinic in the town that I practice in. Done it many times before. Haven't been real happy with some of the things they've been doing, but it was in the best interest for this patient so they could see right away if there was a fracture. I thought it was a lot better than going to the local hospital and having to wait in the radiology department. So anyway, he goes but he doesn't have a shirt because he left it back at the gym. So I gave him one of my scrubs, clearly says Arkfeld Advanced Chiropractic on it. So he's wearing one of my scrub tops in, and I asked him and his mother, I said, listen, so let them know I sent them down, and that if they find out that there's no fracture, have them come back and I can start doing therapy for his sprained ankle. I know you normally wouldn't think a chiropractor would treat sprained ankles, but one that is sports medicine and has the proper equipment like we do very well with it. I mean, we get awesome results, a lot quicker than traditional PT. So with that in mind, send him on down, and the PA, they take the x-rays, no fracture, and next thing I know, and this is where it starts to go downhill. Number one, she put him in a walking boot with crutches and says, do not get out of that boot, wear it even at night for 3 weeks. Wrong. That's not good at all. Because you know what's going to happen? Those muscles in his ankle are going to get weaker. The joint's going to get stiffer. Scar tissue is going to form, but it's going to form to everything. So when you start the actual rehab process, it's going to be a mess. So that was number one that I didn't like. Number two, she referred him on to another PT clinic here in the town that I practice on. Totally just forgot that I sent him down. He told her I sent him down. He's wearing my scrub top, so she knows, and she just refers him right on down to this other PT clinic, fully knowing, because I know this PA, fully knowing that I do an unbelievable job with rehab. Okay? So that was number two. So number three, the specific place that she told him to go to, when the mother called to get in, they said, well, we can't get you in for a month. What is somebody supposed to do? They're supposed to get going right away with PT and they can't get in for a month? I mean, that's just ridiculous. So the mother came back and I said, listen, I'm going to have him done with the total treatment ready to go within a month, but this is what's going to have to happen. First of all, he's going to have to come see me at least 3 times a week. He is going to have to get out of that boot and off those crutches within the next few days. Because I looked at the kid and I said, do you want to play football this year? If you want to play football, you got to do what I'm going to ask you to do. And believe me, staying in that boot and staying on crutches will delay you, and you'll probably miss football season this year. So we started off on our treatment protocol. First thing we had to do was get the swelling down, right? So I did some what we call blading work to work the edema, the swelling out of there. And then I did a very, very gentle mobilization on the joint, because you've got to start getting those joints to move a little bit. There's a neurological component here. And by the way, that's what everybody forgets, the neurological component of rehab. And that's where we really excel. That's probably a whole other YouTube when we talk about when you've gone to PT and it's not working, what do you do? Well, it's because they looked at it from an orthopedic or mechanical structure and not a neurological. The next thing we did, just for that day, we put him into our Normatec compression boots therapy. Look those up. They're big time in sports medicine. They're mainly used for recovery, but we've been using them to pump that swelling out of there. And so we got him on that. And after the first visit, his ankle was 50% reduced with swelling. We then started some very easy resistance band mobilization for the ankle and strengthening. And then we progressed him into our direct current neuromuscular electrical stimulation. That's the game changer. And we did that on him. And by 2 weeks, he's walking normally. By 3 weeks, he's running. And by the July 7th time that he was supposed to see the PT, he's back to normal. I've released him from care. He's good to go. So anyway, I probably should just stop right there. But we're going to continue along with these lines of the most ridiculous things you hear, because it's coming at me so much now. Some of the things that patients say, I just can't believe. And it's like, what's going on with our healthcare system? That's the reason I'm going to just throw this out there. For any musculoskeletal, like neck, back, low back, hip, shoulder, ankle, elbow, if you have a chiropractor in your area that is known for working on all those, or sports medicine type of chiropractic, go see them. Or I tell you what, drop a comment and let's talk about it. I may make it part of an episode. We'll do a whole episode just like I'm doing right now. How's that sound? Anyway, hit the subscribe. Talk to you soon.